Okay, 59A-36.007, Resident Care Standards. An assisted living facility must provide care and services appropriate to the needs of the residents accepted for admission to the facility. Number 1, supervision. Facilities must offer personal supervision as appropriate for each resident, including the following. A, monitoring of the quantity and quality of resident diets in accordance with 59A-36.012 Florida Administrative Code. B, Cheryl?
Daily observation by designated staff of the activities of the resident while on the premises and awareness of the general health, safety, and physical and emotional well-being of the resident. Maintaining a general awareness of the resident's whereabouts. The resident may travel independently in the community. Highlight C because that's a potential test question right there. D, contacting the resident's healthcare provider and other appropriate party, such as the resident's family, guardian, healthcare surrogate, or case manager, if the resident exhibits a significant change.
Contacting the resident's family, guardian, healthcare surrogate, or case manager if the resident is discharged or moved out. Maintaining a written record updated as needed of any significant changes, any illness that resulted in medical attention, changes in the method of medication administration, or other changes that resulted in the provision of additional services. Basically, that's like a log. I wouldn't call it, it's not like nursing notes, but probably like some sort of log that you keep on each resident to note any changes or anything that might happen. And then if on your log, pro tip, what was it again, Cha-ching?
Ching-ching.
On your log, if you note that the resident fell and was sent to the hospital because they needed medical attention, then they'll also probably want to see when they come back, was there a significant change? Did they get a new 1823, a new health assessment? Just pointing you in the they're always looking for clues and where to look next. So, social and leisure activities, Cheryl?
Residents shall be encouraged to participate in social, recreational, educational, and other activities within the facility and the community. The facility must provide an ongoing activities program. The program must provide diversified individual and group activities in keeping with each resident's needs, abilities, and interest. The facility must consult with the residents in selecting, planning, and scheduling activities. The facility must demonstrate residents' participation through one or more of the following methods: resident meetings, committees, a resident council, a monitored suggestion box, group discussions, questionnaires, or any other form of communication appropriate to the size of the facility. I think that would be a test question.
Yeah, that more so that they have to participate and they have a means of participating
and meeting their interests and needs.
Meeting their interests and needs, yeah, and they could have somebody that they may be disabled and they can't do certain activities and like painting and they can't utilize their arms properly. Then you have to really modify your activities to meet the needs of the residents. And the surveyor would observe your activity. And if you have residents just sitting there and they can't participate, then you're not actually meeting their needs. Scheduled activities must be available at least 6 days a week for a total of not less than 12 hours per week. So 6 hours, 12 hours per week. Watching television is not an activity for the purpose of meeting the 12 hours per week of scheduled activities unless the television program is a special one-time event of special interest to residents of the facility. A facility whose residents choose to attend day programs conducted at adult daycare centers, senior centers, mental health centers, or other day programs may count those attendance hours towards the required 12 hours per week of scheduled activities. An activities calendar must be posted in common areas where residents normally congregate.
The test questions are the 6 days, 12 hours. That could be, you can't do 12 hours on one day and nothing the other 6 days. So you have to spread it out over the week. And then the television one-time event could be like Super Bowl or the Grammys or, Kentucky sports Derby, something. Yeah. So kind of make it into an activity and a party.
Yep.
If the residents assist in planning a special activity such as an outing, seasonal festivity, or an excursion, up to 3 hours may be counted toward the required activity time.
Yeah. basically your facility is going to have a set program that automatically fills the 12 hours, and then I think special events would just be additional things that are above and beyond. That way you don't have to worry about that. But it will be a test question. Number 3, arrangement for healthcare. In order to facilitate resident access to healthcare as needed, the facility must A, assist residents in making appointments and remind residents about scheduled appointments for medical, dental, nursing, and or mental health services. B, provide transportation to needed medical, dental, nursing, or mental health services, or arrange for transportation through family and friends, volunteers, taxi cabs, public buses, and agencies providing transportation.
The facility may not require residents to receive services from a particular healthcare provider.
Okay.
Activities of daily living. Facilities must offer supervision of or assistance with activities of daily living as needed by each resident. Residents shall be encouraged to be as independent as possible in performing activities of daily living.
Nursing services, let's take a look. I think we're still within... let me check back here. Nursing services. Yeah. Nursing services pursuant to 429.255. The facility may employ or contract with a nurse to take or supervise the taking of vital signs. Number 2, manage pill organizers and administer medications as described. Give prepackaged enemas pursuant to a physician order, and maintain nursing progress notes.
So the nursing services listed above may also be delivered in the facility by family members or friends of the resident, provided the family member or friend does not receive compensation for the service.
Yeah. Resident rights and facility procedures. So a copy of the Resident Bill of Rights must be posted in full view in a freely accessible resident area and included in the admission package as well. You can get a poster for the Resident Bill of Rights from the Ombudsman, but it also has to be in the admissions package.
Right.
B, in accordance with Section 429, the facility, I think that's the Bill of Rights, must have a written grievance procedure for receiving and responding to resident complaints and a written procedure to allow residents to recommend changes to facility policies and procedures. The facility must be able to demonstrate that such procedure is implemented upon receipt of a complaint.
The telephone number for lodging complaints against the facility or facility staff must be posted in full view in a common area accessible to all residents. So we always had ours when you first walked in on the corkboard. We had all the important things that have to be posted right there.
I think there is one document from the Ombudsman or ACA that lists all of this
all
information
the phone numbers.
as well. Yeah.
Right. So the phone numbers must be posted in close proximity to a telephone accessible residence, and the text must be a minimum of 14-point font. The facility must have a written statement of its house rules and procedures that must be included in the admission package. The rules and procedures must, at minimum, address the facility's policies regarding
the residents' responsibilities, alcohol and tobacco use, medication storage, resident elopement, reporting resident abuse, neglect, exploitation, administrative and housekeeping schedules and requirements, infection control, sanitation, universal precautions, and the requirements for coordinating the delivery of services to residents by third-party providers. Residents may not be required to perform any work in the facility without compensation. Residents may be required to clean their own sleeping areas or apartments if the facility rules or the facility contract includes such a requirement. If the resident is employed by the facility, resident must be compensated in compliance with state and federal wage laws.
The facility must provide residents with convenient access to a telephone to facilitate the resident's right to unrestricted and private communication. The facility must also allow unidentified telephone calls to residents. For facilities with a licensed capacity of 17 or more, in which residents do not have private telephones, there must be, at minimum, a readily accessible telephone on each floor of the building where the residents reside. So that's another thing to put in your 17 or more category column to study for your test, that there has to be an accessible phone on each floor if they don't have one in their rooms.
17 or more, yeah.
Correct. In addition to this requirement, the use of physical restraints by a facility on a resident must be reviewed by the resident's physician annually. Highlight that. Any device, including half bed rails, which the resident chooses to use and can remove or avoid without assistance, is not considered a physical restraint.
But full bed rails would be.
Correct. Yeah. And then it has to be reviewed and documented annually.
Yeah. You still need an order for half bed rails too.
Correct.
Okay, third-party services. Nothing in this rule is intended to prohibit a resident or a resident's representative from independently arranging, contracting, and paying for services provided by a third party of the resident's choice, including a licensed home health agency or private nurse, or receiving services through an outpatient clinic, provided the resident meets the criteria for admission and continued residency, and the resident complies with the facility's policy relating to the delivery of services in the facility by a third party. The facility's policies must require the third party to coordinate with the facility regarding the resident's condition and the services being provided.
When residents require or arrange for services from a third-party provider, the facility administrator or designee must allow for the receipt of those services, provided that the resident meets the criteria for admission and continued residency. The facility, when requested by residents or representatives, must coordinate with the facility to facilitate the receipt of care and services provided to meet the particular resident's needs.
If the residents accept assistance from the facility in arranging and coordinating third-party services, the facility's assistance does not represent a guarantee that third-party services will be received. If the facility's efforts to make arrangements for third-party services are unsuccessful or declined by residents, the facility must include documentation in the resident's record explaining why its efforts were unsuccessful. This documentation will serve to demonstrate its compliance with this subsection. I don't think you'll have a test question on that, but it's good to know.
Right.
Have a general understanding of this information, because it's really hard for us to predict exactly what's there.
Elopement standards. Residents assessed at risk for elopement. All residents assessed at risk for elopement or with a history of elopement must be identified so the staff can be alerted to their needs for support and supervision.
Ding, 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 ding.
All residents must be assessed for risk of elopement by a healthcare provider or mental health care provider within 30 calendar days of being admitted to a facility. Calendar days, remember, is different than 30 days.
Yeah.
So, business days, I'm sorry. If the resident has had a health assessment performed prior to admission, this requirement is satisfied. A resident placed in a facility on a temporary emergency basis by the Department of Children and Families is exempt from this requirement for up to 30 days. So, a few test questions potentially in there. The 30 calendar days.
That's one of the first things I always look for on the 1823 health assessment is like elopement risk, wander risk.
That and transfer, they're very big ones.
Yeah, and
especially elopement, because unless you're secured and you're
I look to see if they are an elopement risk, but also if the healthcare provider checked it off or not. Sometimes it's blank or they didn't.
You're right.
And do it, and so then you would fail this section because they didn't complete the 1823. You read this part as part of the resident elopement policies and procedures. The facility must make, at minimum, a daily effort to determine that at-risk residents have identification on their persons that includes their name and the facility's name, address, and telephone number. Staff trained pursuant to 59A must be generally aware of the location of all residents assessed at high risk for elopement at all times. So I think that could potentially be a question that your staff, for residents that are determined to be at risk.
What's the requirements?
Once a day, they need to at least make sure that they've got some identification on them and what the identification has to have.
Right.
The resident's name, the facility's name and address, and telephone number. The facility must have a photo identification of at-risk residents on file that is accessible to all facility staff, law enforcement as necessary. The facility's file must contain the resident's photo identification upon admission or upon being assessed at risk of elopement subsequent to admission. The photo identification may be provided by the facility, the resident, or the resident's representative.
Facility resident elopement response policies and procedures. The facility must develop detailed written policies and procedures for responding to a resident elopement. At a minimum, the policies and procedures must provide for an immediate search of the facility and premises, the identification of staff responsible for implementing each part of the elopement response policies and procedures, including specific duties and responsibilities,
the identification of staff responsible for contacting law enforcement, the resident's family, guardian, healthcare surrogate, and case manager if the resident is not located pursuant to subparagraph 8. 4. The continued care of all residents within the facility in the event of an elopement. C. Facility elopement drills. The facility must conduct and document resident elopement drills pursuant to this section.
So this is a big one with the elopement drills, because we've even had it where a resident left the facility to go get her hair done and they didn't sign them out. And when one of the caregivers went over to the apartment, she was gone. Mm-hmm. And we had to start our elopement, drill right away, like calling and searching and asking questions. So make sure that this is something your staff is trained on. It's very important.
Yeah, I think let me just break out really quick here to the Florida statutes, because basically here it says facility resident elopement drills. Facility must conduct and document resident elopement drills pursuant to sections 429. So let's just pull it up so you guys are familiar with. Do a search, 429. And it was under elopement. Subsection 1A3. 1A, here it is, right here, 1A3. So you go 1A3. Yeah. Resident elopement requirements. Facilities are required to conduct a minimum of 2 resident elopement prevention and response drills per year.
Test question.
All administrators and direct care staff must participate in the drills, which shall include a review of procedures to address resident elopement. Facilities must document the implementation of the drills and ensure that the drills are conducted in a manner consistent with the facility's resident elopement policies and procedures. Definitely a test question. Pro tip: when the surveyors, you gotta be faster.
Well, that's your job. That was a change.
No. Okay. When the surveyors come out to do their survey or whatever inspection, they're going to ask your staff. They're going to ask your residents. Have they been in any elopements? They'll ask your staff, have there been any elopements? Are you aware of any elopements? They're going to ask your staff, have you done elopement drills? What are your responsibilities? They'll question them on the particulars of what they're supposed to do if an elopement happens, because they really want to know that that they've had the training. I mean, they can look in the file and see a certificate that says elopement training, or that it happened, but they want to actually make sure that the staff actually know what to do.
Or know what it is. I mean, there's nothing worse than questioning your staff and they don't even know what the word elopement means.
Yeah,
in relation to the facility.
I would say that it's such an important topic that I would review it more often so that your staff knows, and also your fire, all of these important things, like when there's an emergency, just have them know it. What do I do? There's some safety professionals, and they memorize step by step what they're supposed to do when this happens.
Emergency response.
Emergency response. I do A, B, C, D, E. If all of your staff know exactly what to do in a situation like this, first of all, it's going to keep residents safer. It's going to demonstrate that your staff really know what they're doing. But the way to do that is to just do it on a regular basis. Pull a staff member aside and say, hey, what would you do if there was an elopement? Let's initiate an elopement. How would you do this? How would you handle that? So it's all in preparation, but understand that those inspectors will ask. And a test question is a minimum of 2 resident elopement prevention and response drills per year, documented in your facility records. They will ask that on the test, and they will ask it when they do an inspection. Is that it?
That's it.
See you later.